For many older adults, the end of the day is marked by a familiar and uncomfortable heaviness in the lower legs, but the hours you spend sleeping are actually the most effective time to reverse this condition using 7 specific bedtime adjustments. Swelling in the feet and ankles, medically known as edema, is often the result of gravity fighting against your circulation all day long. When you lay down to sleep, you have a unique opportunity to use gravity, positioning, and temperature to drain that accumulated fluid back into the body's central circulation system where it can be processed and eliminated. Here are 7 specific bedtime fixes that help drain foot swelling overnight. 1. The pillow ramp elevation. The first and most mechanically effective fix is to restructure how your legs are positioned while you sleep. Simply lying flat in bed is often not enough to drain severe swelling because your legs are still roughly on the same level as your heart. To actively drain fluid, you need to create a gentle slope. This is often called the pillow ramp. The physics of this are straightforward. Fluid acts like any liquid. It flows downhill. By elevating your feet so they are physically higher than your heart, you allow gravity to pull the excess fluid out of the tissues in your feet and ankles and move it toward your torso. This takes the workload off your veins, which usually have to pump against gravity. To do this correctly, you cannot simply place one thin pillow under your heels. This often leads to the knee hyperextending, which can cause pain in the knee joint by morning. Instead, you want to build a graduated ramp. Use 3 standard pillows, place the first 2 side by side to create a wide base, and place the third one on top in the center. Alternatively, use a wedge pillow specifically designed for this purpose. The goal is to support the entire lower leg, from the back of the knee down to the heel. When you position your legs on this ramp, your knees should still have a soft, slight bend in them. This prevents strain on the hamstrings and the knee joint itself. The feet should be elevated about 6 to 12 inches above the level of the heart. You do not necessarily need to sleep in this position all night, as that can be restrictive for side sleepers. However, lying in this position for 30 to 45 minutes before you drift off to sleep is often sufficient to jumpstart the drainage process. Many seniors find that reading a book or listening to quiet music while in this ramp position provides immediate relief from the throbbing sensation of swollen feet. By the time you are ready to turn off the light, a significant amount of fluid will have already left the extremities. If you can sleep on your back comfortably, keeping a single pillow under your calves throughout the night will continue this benefit. This uses gravity to do the work for you. It requires no medication and no effort, simply a change in geometry. This works well for most older adults and is the foundation of managing nighttime swelling. 2. Sleeping on the left side. Here is another simple habit that involves body positioning. While elevation works well for back sleepers, side sleeping is often preferred by many seniors. If you are a side sleeper, choosing the left side over the right side can make a biological difference in how your body manages fluid. The reason for this lies in your anatomy. The largest vein in the human body is called the inferior vena cava. This massive vein runs along the right side of your spine and is responsible for carrying all the deoxygenated blood from your lower body back up to your heart. When you sleep on your right side, the weight of your internal organs and your torso can put slight pressure on this vein. While this compression is not dangerous, it can slightly slow down the flow of blood. Think of it like stepping gently on a garden hose. The water still flows, but not as freely. By rolling over and sleeping on your left side, you completely lift this pressure off the vena cava. This opens the hose fully, allowing for maximum blood flow from the legs back to the heart. When the blood flows freely, it clears out the fluid that has pooled in the tissues. Furthermore, sleeping on the left side improves kidney function. The kidneys are your body's filtration plant. They are responsible for filtering out waste and excess water, which becomes urine. When circulation to the kidneys is optimized by left-side sleeping, they can filter waste more efficiently during the night. This often results in waking up with significantly less swelling because the kidneys were able to process the fluid while you slept. It is a simple adjustment that costs nothing. To make this comfortable, place a pillow between your knees. This aligns the hips and prevents the top leg from dragging the spine out of alignment. This pillow also prevents the knees from knocking together, which can be uncomfortable for bony joints. This is simple to do at home. It optimizes your internal anatomy to clear fluid naturally. This keeps the body balanced and ensures that your circulation has the path of least resistance. 3. The bedside bicycle. Another helpful step is a gentle movement routine done right before the covers are pulled up. Often, swelling occurs because the blood has been static or slow-moving in the veins. Before settling into total stillness for 8 hours, it is highly beneficial to perform a brief flush of the circulation using movement. The bedside bicycle is a very low-impact exercise that you can do while lying flat on your back in bed. It does not require high energy or aerobic effort. It is purely mechanical. Lie flat on your back with your head supported by your pillow. Lift one leg slightly into the air and bend the knee, bringing it toward your chest. Then extend it out as if you are pedaling a bicycle. Then switch to the other leg. The motion should be slow and deliberate. You are not trying to get your heart rate up. You are trying to squeeze the muscles. Every time you extend your leg and contract the muscles, you are manually squeezing the veins deep inside the leg. This squeezing action pushes the stagnant blood out of the calves and thighs and sends it toward the heart. It acts like a manual pump. Doing this for just 1 or 2 minutes creates a fresh surge of circulation. It helps to clear out the old blood that has been pooling in the feet since dinner time. Once you stop the movement and relax, your veins are clearer and the fluid has been encouraged to move. If lifting your legs in the air is too difficult due to lower back issues, you can modify this. Simply slide your heels along the mattress, bringing your heel to your buttock and then sliding it back down straight. This sliding motion achieves a similar muscle contraction without the strain of lifting the leg against gravity. This activates the muscles without weight-bearing stress. It signals to the body that circulation is still needed and helps prevent the fluid from settling into a hard, swollen state overnight. This fits into any routine and takes less than 3 minutes. 4th, ankle flexing, the muscle pump. One more easy change you can try is even subtler than the bicycle motion. This exercise targets the calf muscle specifically, which is often called the second heart of the body. The calf muscle is responsible for pumping blood from the lower leg back up against gravity. When this muscle is inactive, fluid pools. You can activate this pump while lying perfectly still under the covers, right before you close your eyes. The movement is a simple ankle flex. Lie with your legs straight, point your toes away from you as hard as you can, like a ballerina, until you feel a stretch across the top of your foot. Hold this for 2 seconds. Then pull your toes back toward your nose as hard as you can, pushing your heel away from you. You should feel a strong stretch in your calf muscle. Repeat this point and flex motion slowly, about 15 to 20 times. This rhythmic contraction acts as a milking mechanism for the veins. It manually forces the lymphatic fluid and venous blood out of the ankle area. It is particularly effective for swelling around the ankle bone itself. You can also add ankle circles to this routine. Rotate your feet in wide circles, first clockwise, then counterclockwise. This engages the muscles on the sides of the calves, ensuring a complete squeeze of the lower leg vessels. Many seniors find this motion very soothing. It releases the tension of the day and can actually help prevent nighttime leg cramps, which are another common complaint. By warming up the muscles slightly with these flexes, you ensure better blood flow throughout the night. This is easy on the joints and can be done even if you are feeling very tired. It requires almost no energy but delivers a high return in terms of circulation. 5. Magnesium lotion massage. Here is another simple habit that utilizes topical therapy. Magnesium is a mineral that acts as a natural muscle relaxant. Many people are familiar with Epsom salt soaks, but doing a full foot soak right before getting into bed can be messy and time-consuming. A more convenient bedtime fix is using magnesium lotion or oil. Magnesium, when applied to the skin, can be absorbed into the local tissues. It helps relax the smooth muscles that line the blood vessels and the skeletal muscles of the feet and calves. When these tissues relax, circulation improves, and the constriction that traps fluid is released. Furthermore, the act of applying the lotion is a therapy in itself. To drain swelling, you must apply the lotion using specific strokes. This is known as manual lymphatic drainage. Sit on the edge of your bed or propped up with your knees bent. Apply a small amount of magnesium lotion to your hands. Start at your toes and stroke firmly but gently upward toward your ankle. Then continue the stroke from your ankle up toward your knee. It is absolutely critical that you always stroke upward toward the heart. If you stroke downward toward the foot, you are pushing fluid back into the swollen area. You want to guide the fluid out. Use broad, sweeping strokes with the palms of your hands. Imagine you are smoothing out a wrinkle in a sheet, moving it from the bottom to the top. Do this for about 5 minutes on each leg. The combination of the magnesium relaxing the tissues and your hands physically pushing the fluid creates a powerful drainage effect. It also moisturizes the skin, which is important because swollen skin is often stretched, dry, and itchy. This supports circulation and skin health simultaneously. It is a calming ritual that signals to the brain that it is time for sleep. This works well for most older adults and provides immediate comfort. Sixth, the cool rinse technique. Another helpful step involves temperature therapy. While warm baths are relaxing, cool water has a specific physiological effect that is excellent for swelling. Cold causes vasoconstriction, which means the blood vessels shrink slightly. When blood vessels constrict, they physically squeeze the fluid out of the tissues and push it back into the deeper circulation. It creates a tightening effect that counteracts the boggy, puffy feeling of edema. Right before you dry your feet to get into bed, run them under cool, not freezing water for about 30 to 60 seconds. You can do this using a handheld shower head or simply at the edge of the tub. The shock of the cool water will cause the surface vessels in your feet to contract immediately. This drives the fluid out of the surface pooling areas. After the cool rinse, pat your feet dry with a towel and immediately get into your warm bed. This creates a contrast therapy effect. The cool water flushes the fluid out, and then the warmth of the bed gently dilates the deeper vessels, inviting fresh, oxygenated blood to flow in. This cycle of cooling and then warming stimulates the vascular system. It prevents the stagnation of blood. It is especially refreshing in the summer months when heat often makes swelling worse, but it is effective year-round. If getting into the tub is difficult, you can keep a damp, cool washcloth by the bedside and wrap it around your feet for a minute before sleeping. This achieves a similar effect. This is a refreshing way to end the day. It uses the body's natural reaction to temperature to manage fluid levels. This helps the body function more easily and reduces the feeling of heat and tightness in the feet. 7. Releasing constrictions, loose sleepwear. One more easy change you can try is strictly environmental. Your lymphatic system is extremely sensitive to pressure. Unlike the blood, which is pumped by the heart, lymph fluid moves slowly and passively. Even a very slight amount of external pressure can block its flow. Many seniors unknowingly wear sleepwear that acts as a mild tourniquet, pajama pants with tight elastic waistbands, or sleeping in socks that have tight elastic cuffs, can create a dam effect. If you have a tight band around your ankle or your waist, the fluid trying to drain from your feet back to your torso hits a roadblock. It accumulates behind the restriction. You might wake up with your feet still swollen, not because your body couldn't drain the fluid, but because your clothes prevented it. Inspect your sleepwear critically. The waistband of your pajama bottoms should be very loose. You should be able to fit a fist inside easily. If it leaves a mark on your skin, it is too tight. Ideally, sleep without socks. If your feet get cold and you must wear socks, choose diabetic socks or non-binding socks. These are designed specifically to stay up without squeezing the calf or ankle. They have a loose, wide weave that puts zero pressure on the skin. By removing these constrictions, you open the highways for fluid drainage. You allow the elevation, the movement, and the positioning to work without interference. This ensures your circulation is unrestricted throughout the night. It is a passive fix that requires no effort other than choosing the right clothing. This fits into any routine and eliminates a common hidden cause of persistent swelling. Conclusion. Managing foot swelling is not always about taking a pill. Often, it is about understanding the mechanics of your own body. By using the 8 hours you spend in bed to your advantage, you can turn sleep into a therapy session. Whether it is building a pillow ramp to utilize gravity, using the bedside bicycle to pump the veins, or simply loosening your sleepwear to allow for flow, these small adjustments add up. You may find that waking up with lighter, less swollen feet becomes your new normal. If you know someone over 50 who could benefit from this, share this video. And subscribe for more simple health tips.